Well, I'm going to welcome our next speakers to the stage, and we're going to be talking about some lessons in the NTD space. Actually, one of the success stories has been the investment in NTDs and a lot of successes, but given the current climate and global health past year, there's a real concern and worry that we're going to see that backslide. So I would like to welcome to the stage our speakers, Dr. Sende Isiyaku, who's Executive Director for Reaching the Last Mile at Sightsavers, and Dr. Joseph Kwadwo Larbi Opare, who is the Program Manager for NTDs at Ghana Health Service. So please welcome. Thank you. So as I said, non-tropical diseases, and I feel like in this room we can throw around these acronyms, but just in case, I know we have a lot of acronyms in this health space. But it's been one of the highest impact investments in global health, where we've seen some really promising gains and feeling like the progress is toward Sustainable Development Goal 3 is within sight. But as we are dealing with some of the drawback in global health funding, there's a real threat that a lot of that work could be undone when we are so close to seeing even more progress. And Dr. Opare, I would like to start with you. Ghana has already eliminated 3 NTDs as public health threats: skinny worm, trachoma, sleeping sickness. Now we're targeting other diseases, but that is a pretty remarkable success. And so what does the health system strengthening work behind that look like? And what actually sits behind those achievements that we could carry forward?
Right, thank you very much for the question. So as you rightly said, Ghana has been able to eliminate guinea worm right from 2015, trachoma in 2018, and sleeping sickness in 2023. And with onchocerciasis and lymphatic filariasis, we are almost there. When it's about health systems strengthening, it's all about teamwork and community engagement. We need to work at all levels of health service delivery, bringing our people at all the levels together, make sure that our data is okay, verified and validated, and also we make sure that we engage the communities about neglected tropical diseases, so that when they identify cases, they refer them to the health facilities. And we also need to build an enabling environment at the health facilities, so that when the patients with NTDs come over, we're able to accept them, they're able to use the system. So we are trying to get them registered into the National Health Insurance Scheme so that they will access healthcare easily. Thank you.
Thank you. And I want to talk to you about Dr. Isiyaku, the international funding contracts, and kind of what happens when the funding goes away to programs like this? What are the repercussions? And how do you think the governments can respond when the funding goes away?
Listening to you in your intro just makes my heart melt, because the reason is that Sightsavers has been supporting neglected tropical disease for over 70 years. I'm not sure we've had it in a situation whereby we've seen a significant dwindling in terms of international support for neglected tropical disease. This is a huge challenge, but what we've seen is it has now forced us to see this as an opportunity. Neglected tropical disease over the decades has focused a lot on external funding, particularly to countries in Africa, where health is not one of the top priorities in terms of government budgeting allocations and release of funds. The diseases are neglected not because of anything, but because they are those diseases that you don't wake up tomorrow and you're dead. They don't take you to the hospital every day, but most importantly, they don't receive the kind of resources they need. Then imagine the one source of resource, which is the external resources, has suddenly gone down. So that's a big hit. Working with the Reaching the Last Mile Fund, I think for us has given us a great opportunity to say, now that we had this challenge, what do we do differently? Domestic resource mobilization is one thing that we are really, really focusing on, which is asking the government if we are able to provide you with some of these resources, then we want to see you match those resources to be able to ensure that we do not stop the work. I mean, Dr. Opare just talked about eliminating 3 diseases in Ghana. If we don't keep at this, I don't see us eliminating more diseases in more countries. So we are at the place where we are reaching the last mile of the race, where the most energy is required, the most resources is required. So we have to explore, do we have those funds in country? Where can we tap those funds? What activities can government specifically fund? And what can we say is value for money? So looking at domestic resource mobilization, I think it's a way that government can actually step up and fill in those gaps.
Yeah, and as you say, I mean, there's so much promised for more eradication, but also potentially going backwards in a lot of the progress that you've made. You know, two things stand out from the Sightsavers experience as particularly effective at mobilizing governments to, invest in their own systems. And the first is the incentive models like the RLMF, where donors match government commitments. The second is data, and funding disease surveys aren't always the most glamorous thing to fund, but the evidence they generate is really valuable for helping governments understand how to act. So how do you see those tools working together?
I think, like you said, data is not the most glamorous. So when you ask people to fund surveys, to generate data that will provide the evidence to demonstrate that we're reaching elimination, people kind of don't want to do that because it's not glamorous. But what it does, it tells us that we have invested a lot. This is the time for us to provide the evidence to say this investment has yielded the kind of result we expect. We need these surveys to be able to say, we have eliminated, we have not eliminated, this is where we are, and this is what we need to do. So that data is quite critical. A lot of countries are now exploring how they can work with the WHO to be able to generate those data on an annual basis and have a kind of a roadmap as to this is where we are, and this is where we hope to see ourselves in the next few years, 1 decade from now, in terms of elimination. If you look at some of these diseases, we have been trying to eliminate or control them for over 50 years, and we are not yet there. We need to change how we do things. In this day of technology and AI, I think we can do better. So data becomes very critical. You see people developing diagnostics that talk about how can we generate data more fast, more efficient, that can help us to make very conclusive decisions in terms of elimination. And I think that is going to be very key going forward.
And I believe we have a video that we are going to tee up. I don't know if you have any context you want to give before we show the video. No. All right, we can pull up the video now.
The mosquito that causes malaria is the same mosquito that transmits LF.
It takes Eranthenius to break the cycles to eliminate the LF disease. More than 20 countries have done it. Ghana can do it too.
I don't just treat a disease, but I really care for people. I see progress, and that keeps me going.
And I know that's part of a longer video that we'll have a QR code that we encourage you to look at that really helps illustrate the challenges and the opportunity of really tackling these diseases. Dr. Opare, I'd like to bring you back in, and you mentioned this around your National Health Insurance Plan. And Ghana is close to a real milestone of getting NTDs covered. Can you walk us through the journey to get there and what it takes to build the case and get it off the ground?
Right. So thank you very much. Thank you very much for the question. With neglected tropical diseases, most of the people suffering from it live in remote areas. They are suffering from poverty and so forth. So we've been trying to get all these people access healthcare at no cost. And what is the what is the avenue we have? Is basically getting them involved in the National Health Insurance Scheme. So we've done several meetings and gotten to almost the end to make sure that we get these people registered, especially patients suffering from lymphatic filariasis. You see, the stigma is so great. So when we get them involved or registered into the National Health Insurance Scheme, you should be able to go. So we are almost there. Thank you.
That's amazing. Yeah, really, really exciting. So, Dr. Isiyaku, the workforce built for NTDs delivery is now being deployed for malaria control and other interventions, creating kind of really a one-stop shop at the community level. And how transferable is that model? And what did it take us behind the scenes of how to make that work?
Oh, very, very transferable. And I would say, in my 3 decades of doing this business with Sightsavers, I think it's one thing that you can talk about that you can see that is very tangible. The workforce, as you said. Now, the workforce is developed around community volunteers who understand the disease, who understand their community needs, and who volunteer to provide that service. It was piloted in the mid-90s by WHO, and it found out that it worked very well for onchocerciasis, and it's now being used for 5 preventive chemotherapy NTDs. Malaria is now using it. Some countries have even used it for TB, and we are seeing more and more vitamin A. In fact, as it is now, I know that there is a country where this is being used as part of an integrated program for immunization. So that workforce is there, and it is not dependent on government. They accept that we have a problem in our community. They understand that it's our own health for our own selves. If we don't do anything about it, there's always going to be a problem. We have had cases about attrition. So because these are volunteers, for one reason or the other, they tend to move. But the good thing is, it's not about the community volunteers, it is about the community. The community understands the need. So if anybody moves, they make the efforts to provide somebody to take that space. And I think that has hugely, we've always said, they are the unsung heroes of the successes of elimination. And that, I think, it's a workforce that we would see that would take us to elimination.
Yeah, that's really exciting. And what do you think that those community healthcare workers need more support of? I mean, many of them are volunteer, and how can countries or initiatives like yours better support their work?
I think first is recognition. What we've seen is we want to be recognized that we are contributing to the health workforce. That recognition is key. Secondly, is for government to see them as not just focusing on neglected tropical disease. If I say I want to be health responsible, accountable, where I come from, if you give me more responsibilities, it makes me feel important. That's the reality. Of course, some people will say then there is the issue about how do you remunerate them, even though they are volunteers. But I know that a lot of these programs provide some kind of transport stipends, feeding stipends. Imagine if you've got this group of people providing that same service at the community level, and instead of you providing different incentive, I'm providing different incentive. If this is pulled together and provided to support them, they are not salaried, but their allowances allows them to be able to feed during the work or to transport for training. I think if you've got that integrated way of doing things, you're going to see a more stable workforce at that level that can help us at community service delivery.
So, Dr. Opare, there are a lot of people here this week are making kind of their pitch and their case for why their corner of global health should be prioritized, and kind of feels like a competition for resources. So what would be your pitch for prioritizing investments in NTDs?
Well, we should go ahead, and we have several of them. You see, let's say last year, all right, we were challenged with getting MDA on schistosomiasis done, right? But through the reaching the last mile, and also through, from Sightsavers, we were able to get some money for onchocerciasis and lymphatic filariasis mass drug administration. So we started and said, now let's look at areas that are co-endemic for onco, all right, and also for schistosomiasis. We managed to do that, and through that, we were able to leverage the resources to treat 13 districts. So that's one avenue for that. Then also, we've been able to standardize the treatment guidelines, revise it so that now every health worker knows exactly what to do when it comes to management of NTDs. So that is another avenue. Then we have community health nurses using electronic community register. Hitherto our intervention, there was nothing on neglected tropical diseases. So now if you manage to put in some indicators on NTDs, and it's working. And the last one is about getting people with neglected tropical diseases registered with the National Health Insurance Scheme. And as I said, we're almost there. And especially with lymphatic filariasis, elephantiasis, people are really going to come out from their remoteness and make sure that they get the needed services. Thank you.
Thank you. And Dr. Isiyaku, your final quick pitch for investing in NTDs?
I think we are at a critical time where we need all the investments we can get. Our focus is mainly now to make sure that we use the opportunity to provide the evidence that will take us to elimination. We have seen more countries eliminating more diseases. Just recently, Egypt just declared that they are trachoma-free. We want to see more countries, and we think we can achieve that very soon. Thank you.
Well, thank you. Thank you both, and thank you for Sightsavers for partnering with us on this session.